Okay, good morning, everyone.
Morning.
Yeah. So, welcome to our BLS workshop. Okay, a little bit about myself. My name is Pek Yasant. You can call me Pek. So, by profession, of course, I'm a registered nurse, and I'm with RCMP since 2010. So, it's going to be 15 years. A little bit on my background. So, I am actually a registered nurse and also a registered midwife and a registered public health nurse. And at the same time, I'm also a certified instructor for basic life support, trained under IJN, based on AHA guideline. AHA is American Heart Association, AHA. So since 2015, so it's going to be how many years?
10 years.
10 years. Yeah, about 10 years. Yeah. And also, I have done my ACLS and been actively involved as a speaker and trainer for various courses, training and workshops since 2011. And for us, our faculty, we actually organizing a few training. One of it, of course, is BLS course, and we also actually organize 20-hour lactation management course for baby breastfeeding, especially for those hospital, baby-friendly hospital. Yeah, and then of course, statistic course also we are organizing. Okay. So for this BLS course, before we go into the course, let us have a look at this. What happened in July last year? You aware of this incident? Yeah. So what about this incident? Suddenly collapsed. This athlete, when during the game, suddenly collapsed. And this athlete from China, but this happened in Indonesia during one of the game. So what happened is, a young boy, and suddenly collapsed during the game. And you see what happened? They said here. This is I get from the paper cutting. They said less than 2 minutes, and they send the victim into hospital. And why you see in the paper, they highlight that, they stress that 2 minutes, less than 2 minutes. And you can see this video. This is during the game. Yeah. The victim is the one in red color shirt. Yeah. This is like some jerky movement, So then stop. And you see what happened? Look at somebody went. And he's trying to, struggling, But they still stand there. Sorry?
Why there is no medic team?
So this is some patient, Okay, see? Wait, it come,
Memang kita biarkan sini ke?
Now came. He may have some jerky movement, but we do not know because we are not there. The heart may stop, respiration may cease. So in this condition, what they need to do actually, they need to start CPR. I already introduced myself. Maybe I should also hear from you. Maybe you will tell what is your name and where are you from and your background. Meaning to say which area you are working at. So maybe who want to start first? Anyone? Okay, we start from here. Yeah.
Hello, Assalamualaikum. My name is Ahmad Takiuddin. Call me Taki. Previous, I joined UniKL August 2024 last year, August. Before that, UniKL we met, and at UniKL we met, I one of ERT team. ERT.
ERT,
And before ERT, committee, safety committee, campus safety committee. But at this station, not become lah during my task lah. No issue.
No issue lah. So after you get trained now,
yeah.
then you will see. Then you know how to help. Yeah.
Okay, thank you.
Another thing is it okay we call you each other by name? We will leave your salutations or your title here. So for these 2 days, we will work together. So like you call me Pak, Taki. Okay.
I'm Hasiana from Future Program, and then I've been working here since 2010. I think
Same.
And then my background, I'm a physio. Last time working in Hospital Fatima. Okay, and then I'm instructor also, so I've been working in hospital safety. Throughout the experience, this situation is about, I think, 4 times in the hospital itself. Because when you cover ICU, it's very common this situation. And then even the cut ward pun, if a code blue, is very common nearby your bed or something like that. And then during the situation, that one, dekat Sukan MRI SEM, last 2 years with the team Yasmin, it's happened in front of our eyes. And then recently, during my clinical student, have one.
So it's the patient.
My name is Santi Buana. You can call me Santi. Okay. I have been here almost 20 years in teaching lah. But in CPR, I knew that I hope I can learn from our awesome trainer and from you participants here. So hopefully we can be a good CPR provider. Thank you.
Okay.
Assalamualaikum, good morning. My name is Nur Soleha. Can call me Soleha. And I'm from physiotherapy department. I'm a clinical instructor. I had experience working at KBT Ipoh for 6 years, and I'm a physiotherapy for ICU ward. So I had experience with CPR, a lot of experience, but I'm not in PLS committee. So I've been working here for 3 years this year.
Okay. So hopefully this workshop will give you some more knowledge and skills so that you can practice.
Thank you.
Hi, I'm Azira from Physio. Previously, working as a clinical physio, I have experience maybe 6 years back. So this one like new learning.
Assalamualaikum and good morning all. My name is Noain. You all can call me Ain. So I'm from physiotherapy program as an assistant lecturer teaching trauma program. So CPR is a new for me. So I hope I can learn the technique and useful technique to save people's lives.
Of course, today the main focus is on BLS, but we will also put in some basic skills or basic concepts, on basic knowledge on first aid. Yeah, sometimes we may not need to go until perform CPR, but some first aid measures, like how to stop bleeding when someone suspected with a fracture or brain injury. So how we want to do splinting and bandaging. So we also integrated. That is a bonus in this course. Yeah. And then of course today morning session we will have all the theory input, and then afternoon solely hands-on. After lunch we will have all hands-on. So no more sitting, all will be on our we will be practical. We will move to skill lab. Yeah. So it's also at this floor, but it will be in MBBS skill lab 1. Okay, 1, yeah. So we will bring you over afternoon. And we will brief you before we break for lunch what you need to prepare for the skill lab session. Then tomorrow it will be exam. Yes. Yeah, tomorrow will be exam. So let's have the general concept of this course, Basic Life Support or BLS. This is the foundation for saving life after cardiac arrest. And in this course, you will learn the skills of high-quality cardiopulmonary resuscitation. I'm sure you heard about this word CPR. CPR actually stands for cardiopulmonary resuscitation for victims of all ages. And the skills you will learn in this course will enable you to recognize cardiac arrest. Yeah, that is one important skill. That's why you see the video that I showed before. Perhaps the team there, they are not able to recognize cardiac arrest. That's why it delay in the whatever action that should be taken. So recognize cardiac arrest. Yeah, this is one of the skills that we want to learn. And then activate the emergency response system early. So in Malaysia, how we want to activate our emergency response system? Call 999. Yeah, 999. And can we call 999 using our mobile phone with different network, different phones? Like, can we call using your phones? Can, yeah. Those days cannot, but now can. Using your mobile phone, you just dial 999. So it will connect you to our emergency response system first. And I'm sure you also hear, how many of you still watch TV or you don't watch TV anymore now because everyone only go for smartwatch, your smart gadget, YouTube. You don't watch TV anymore? You watch TV?
Yeah, sometimes.
Sometimes, yeah? Only see Korean drama. So you see, if you see the TV, it always, from the ministry, they always remind that we don't, a lot of prank call using this 999 numbers. So they actually remind people in in our community. So don't misuse this number. This number is actually kept for emergency. And then in the video, subsequent sessions, we will show a lot of video. And this video actually is from AHA, American Heart Association. So in the video, you will see when they call emergency response, they will say 911. So just excuse, yeah, that is for America. But for us, we will call 999. I stress this again, because otherwise we will see the video at the end. Later when we practice or during the exam, call 911. You will not reach anywhere. So for us, we will call 999. So this basic first aid in controlling bleeding, bandaging, and splitting is included to supplement this training. So as I said, it's a bonus in this training. This is important. Okay. So the content will include the chain of survival. Later it will be delivered, shared by Kalai. Yeah. And then subsequent. Kalai, correct? Yeah. I thought now I call my friend wrongly. Disorientated. Okay. So AHA guidelines for BLS, and we will have adult BLS, infant. Yeah, infant is baby less than 12 months old, excluding the newborn in labor room. Yeah? Excluding. Even though the infant, when we say we define infant, definition of infant is baby who are less than 12 months, less than 1 year old. So if you go by this definition, the newborn also infant. But why in this training we exclude the baby in the labor room? Because that is only for doctors and midwives. So we will have another training for them, what we call an RP, neonate resuscitation program. So for lay person or for healthcare provider, usually for the newborn, resuscitation of newborn in labor room is only by the anesthetist, doctors is the ONG doctors, and midwife. So we exclude the baby in the labor room for this program because it's a different resuscitation. and AED. Now, AED, you know what's AED? Have you heard about AED? Huh? Automated external. Yes. So, do you realize? Is there any AED in our premise?
Yeah. ATM machine.
How many have seen one in our premise? See. Oh, we have. Okay, good. Those who see, good. Those who are not maybe you have not learned AED, you are not aware. So after this training is included AED, then after that when you go down this building, you will see there's AED there. So who knows? We never know, yeah? It can be me, it can be anyone that who required someone trained and know how to use AED when it's needed. So actually now AED is very is a common need, and it is actually placed in most of the public places. When you go airport, I'm sure you will see in airport, and then even in now in some masjid, mosque, also we place it there. Mall, yeah, all the supermarket, mall, and then stadium, and then even in the recreation park in Polo Ground, you also will see AED. Yeah, so now you actually good to know where the AED is placed. When needs arise, when needed, then you know where to go and get the AED. So we will also include in this training how to use AED, and it's also part of the practical test. You must know how to use AED. And then relief of choking and first aid management. So the learning objective, yeah, at the end of the session, participants will be able to apply the 2020 AHA guideline when performing BLS by adhering to the standard practice of high quality CPR. We'll come to that later. What is high quality CPR? Not only we can provide CPR, we want to provide high quality CPR to have the most possible positive outcome or increase the chance of survival for the victim, and provide BLS for adults and infants. Yeah, and in a safe, timely, and effective manner. And the assessment will include theory tests and practical tests. And theory tests will be 50 MCQ questions in English, 50, multiple choice, single response. There's only one correct answer. And as this is a certification course, so the passing mark is actually 42 over 50. So minimum you must achieve 42. So how many questions you can get wrong? 8, yeah? You can only get wrong 8 questions. But don't worry, I'm sure you can pass with flying color. Okay? Yeah? And then practical test. For practical test,
if not less than 42, then repeat the exam.
okay, yes. So I'm sure, and all these the questions that will be asked is actually included when you follow from the first sharing, the first presentation until your practice. The question will be what we are doing these 2 days. Yeah. So if you can.
Then the notes you will share with us, kan?
Yeah, later I will let you all scan the QR code and notes there. So, okay, it's like that. So tonight, I know your weekend already spoiled. So today you go home, I'm sure your family go ask you out and say, don't disturb me, I want to study. Yeah, not only study, you want to have practical also. So I can foresee today, the pillow and bolster, if you use the bolster, or the pillow in your house, you will be fully utilized because you want to do compression. Yeah, so you will use so. Because you cannot bring the baby back. Okay, I must remind all the facilitators, we must count our baby. Last time we go for another training, they like our baby so much, then we come back, where's our baby? Somebody holding our baby. So we must count our baby. Count our baby, and you don't bring our baby home, the baby is only here. Nobody want to bring the adult home. Anyone want to bring the baby home? Don't bring the baby home, yeah? So, for the practical test, Practical test is including 1 man CPR, adult. So you do alone. 2 men, that means 2 person. So we will get the partner for you. You cannot choose your partner. We will choose for you. Yeah, during the practical exam. So 1 man, 2 men, AED. AED will go together with 1 man. But later practice we will put together with two men. Yeah, but you will have this practical exam tomorrow. And then infant BLS, baby, yeah, how to save baby's life. And then relief of choking for adult, for baby. Okay, are we all ready?
Yes.
Yes, huh?
You said 2020 guideline, right? So after that, there is no new guideline?
Okay, so very good question. See, every 5 years the AHA will review. Every 5 years AHA will review. So you see 2020, so the next will be 2025. Yeah, but 2025 the guidelines usually from the state, they will review the guideline. When come to Malaysia, usually it will take some time. But at the moment, we still use the 2020. The 2025 not in place yet. Yeah. So when any update, I will also share later. Yeah, from 2010, 2015, 2020. What are the changes or what are the added improvement done? Yes. Yeah.
So if new guideline, we have to attend course again, or our certificate will be valid for until 2020?
Okay. It's still it will be our BLS provider is only 2 years. Yeah. So like now we certified you, so it will be 2 years. It's still valid. It's still valid. 2 years. Yeah.
Then after 2 years we have to.
Yes. After 2 years, you will come for refresher course. Yeah. If refresher course sometimes it may not need so long 2 days. It may not be long a full 2 days. So if you are ready, you know sometimes they can do it. They can do in 1 day. Or some center they do it half a day. But provided you really have already experience. Otherwise, it is still advisable that you go through the practical again.
So for refresher course also you provide?
Yeah, we actually doing also, and of course there are many centers that are doing, but since we are doing AHA, we will follow back AHA. And most of the private hospital actually following AHA. Now, of course, in our KKM hospital, they will use NCOT. Like for our nursing students, we actually will share with them both. Yeah, but actually it's similar. It's similar. Just that NCOT, they break down the steps, and certain steps AHA already dropped since 2010, but NCOT they will still do that. But actually, when we come to life saving, when the patients, when the patient collapse, so what we share now later, you will see, we will do like step 1, step 2, step 3. But in the actual clinical, actual situation in clinical, when patient collapse, usually it's a team effort. It's a group dynamic. We have a group, coordinated group, because you cannot be alone in a hospital setting. But why we train this BLS course, why it's so important? As the first responders, especially like it can be anywhere. What if out of hospital setting, not in the hospital? What if it can happen in the college, or it can happen anywhere? So what are you going to do first in order to save life? That's why later we will come to the chain of survival. So you will start from the chain of survival, then you will know why it's so important for us to learn BLS. And we want to certify as many people as possible in the community. Yeah. So this is our team, the BLS team. Of course, at the moment, our BLS team, we put it under FOM, but hopefully we also can have facilitators from Accreditation joining us, so we can have RCMP team. Yeah.
Sorry to ask you again.
Yeah.
Once I finish, I am eligible to provide, I understand.
Yeah.
But I want to teach to my student.
Okay.
So, am I eligible instructor, or there is a different course for instructor?
Okay, so actually to teach your student, I believe you can do that because you are not certifying the student. But if you certify the student, as like for us nursing, we will certify our student before they graduate. So if you want to certify, then you must have in the team, you must have at least one certified instructor. So if just for student learning, like physio also doing, I'm sure physio also doing, pharmacy also they are doing. So your program you can do, you can train you can provide to your student for their knowledge, for their skills, it should be okay.
But for certification,
For certification, you must in the team must be at least one certified instructor.
so if any one of us with your team, so
Yeah.
we will be
Facilitated. Yeah. Yes. So we also will have, like for example, for our team when we go out, usually we will see a mixture of our skills. Like for me later, you will see, I am more, even though I'm an instructor, but for me, I will focus more on infant. And then like you see, Siva, she will be in infant. So when I have my team, I will have a mixture of specialty. Yes.
I'm interested to join your team.
Yeah. Why they also have this disease. So if you may want to look back, maybe they say yes, I am living very healthy, prudent, hard living, but what you don't forget about environment. Our environment, secondhand smoke. Yeah, secondhand smoke. Even more, more dangerous than you are the one that's smoking. Because the smoke is some filter. There's some filter. Yeah, passive smoking, we don't have filter, Whatever you smoke, you puff out, then we inhale. And you are unaware, and silently we are inhaling. And worse, if that person has some comorbidity. For example, I'm an asthmatic patient. My lungs already, my airway is easily get triggered and constrict, and with all these factors come in, and then also stress. Now, of course, we don't put here. Stress level will increase. It change our body physiology, and then this temperature. Of course, we also need to read more like what the Kalai said, but for the sudden change of temperature, it usually will not really happen in our country, or even in the country with 4 seasons, they actually will gradual change. You see, but of course now with the climate change, I see again another thing, climate change. Now is because our earth, our land already diseased because of human error, human actions. That's why we need to actually promote go green. We want to save the environment. So of course, change of temperature, yes, especially high altitude. When you go for a place at high altitude, yeah, because the high altitude and then the temperature difference. So for example, like for us, to go there, you need to have training. You need to get your body adapted. Otherwise, it will affect the oxygen uptake and all that. So it may be affected if a sudden climate change. We will not know. It may also affect us. That's why now we also need to play our role to save the environment. Yeah, it can be a problem, or even like may not be heart. It can be respiratory. Like for me, if I go to Genting, for example, a very cold environment, so my airway will get constricted because it will trigger the constriction of the airway because of the cold temperature. The physics, hot, it will expand. Then cold, yes. Yeah. So it may happen into our vessel because our vessel have elasticity, which can dilate, can constrict. Then it constrict, it go to the heart constrict, then the heart will block. It constrict, the small blockage go to the brain will, yeah, it happens. And then go to the lung, happen to the lung. So, okay, yeah, thanks.
So what about gender?
Okay, gender.
This question, because nowadays I see gender is modifiable because people are translating from one gender.
Yeah, in a way, you only that is human, yeah, physical. And then you see, because it's only physical that you try to change. Of course, for those male want to become a female, of course you can go and change, you can go and inject or whatever will change the external organ. Yeah? But internal, your hormone cannot, it's actually one reverse. That's why they inject. Yeah, to make it the skin very pretty, then they inject hormone. They inject of course female hormone. So to make them keep whatever they want,
So what about the heart disease then? If the heart hormone change,
Yes,
the
yes.
risk factor go down.
The risk is increased because that's why for a female, why after menopause, as a female, after menopause, our risk increase because we are not protected by the hormones. Yeah. So it could be. Yeah. And not only for this, it can also increase other risk, risk for other cancer. Welcome back. So we will continue. Now what you have learned just now, the chain of survival. So you revise for the MCQ questions. Definitely there will be questions asked regarding what, like example, the chain of survival, the in hospital and out hospital, and then the pediatric chain of survival. So all these, then the different heart disease, prudent heart living question. There may be questions, and also the modifiable and non-modifiable factors. So all these questions can be asked in the practical, in the theory exam. So we will continue in this session. We will learn at the end of the session. You will be able to define cardiopulmonary resuscitations, recognize the signs of someone needing CPR, state the high quality CPR. Later we will come to that. High quality CPR. By end of today, you should be very clear, and you should know what is high quality CPR and able to practice. And then perform high quality CPR for adult, child and infant, demonstrate the appropriate use of AED, and perform the techniques for relief of foreign body airway obstruction, which is choking, for an adult, a child and an infant. Okay, when the heart stops beating, the person is in cardiac arrest. You know, in cardiac is medical term for heart, heart. So when the respiration ceases, the person is in respiratory or pulmonary arrest. And heart and lung, usually they will work together. They work together very closely. So when the heart stops, it also will affect the respiratory system. So the cardiac and respiratory system is dependent on each other, that when one fails, the other will also fail. And this is where we call cardiopulmonary arrest. Cardiac means the heart and lungs. So there are two systems here. Yeah? So this is what we call cardiopulmonary arrest. And the most important determinant of survival from cardiac arrest is the presence of an rescuer who is ready, willing, and able to provide cardiopulmonary resuscitation, or what we call CPR. That's why we want to train as many BLS providers as possible. When things happen, when cardiac arrest happen, it may not be in the hospital setting. In the hospital setting, it's okay, we will quickly call for code blue, and the whole team will come. But what if this happens outside? It can be in the workplace, it can be in the shopping mall, it can be even during, like the example, the case that happened during a game, that last time during the sports event. So it can happen anywhere, anytime, to any person. And we have people who are trained there, the first responder or the first rescuer, so you can definitely increase the chance of survival. So CPR is a practice combining chest compression and ventilation. So here, when we do CPR, there are two main skills. One is do a chest compression. And chest compressions, when we do compression of the chest, it is always for the heart, pumping of the heart. Yeah? And then ventilation is respiration, is breathing. So these two we will combine. And the simple steps of CPR performed effectively is important. Not only we know the steps, you must perform effectively, timely, as we learned just now from the previous session. A biological brain death happened. When? How many minutes? 4. It's within 4 minutes. Yeah? And why? Because our brain is an organ that needs a continuous oxygen supply. Yeah? We need that heart, brain, we need continuous supply in order for us to live. So we miss the golden time, we miss the time that if the patient go into biological brain death, it's not died yet, they have not died yet, but is there any quality of life? They may not have quality of life. Meaning to say they are just on the bed, they will be bedridden, they will not have any emotions, and they may depend on the machine, the ventilator to breathe. Just to keep them so-called alive, but there's no quality. Yeah. So when we give CPR timely, effectively after cardiac arrest, it may mean the difference between life and death, full recovery, and rehabilitations. Now, of course, I'm not saying that all the CPR we do, 100% we will save the victim. We also have cases a lot in the hospital that we have performed even 1 hour resuscitation, so long, but we still fail to save the patient. There are also incidents. But of course, when this thing happens, when cardiac arrest happens, when we can act fast, we can increase the chance. So that's why we said we increase the chance of survival. It's not that 100% we can save, but increase the chance of survival. So who can perform CPR? What do you think? Who can perform CPR? Yeah, it's anyone. If you learn this, anyone. Anyone who are trained. So for example, I am trained. Yeah, I'm trained. So I'm traveling or flying in the flight. Going for holiday, wow, after so long. Going for holiday in the flight. And then suddenly there's an announcement. We have a case, a victim or something. Is there any medical staff on board? Any doctors or nurses on board? Yeah? Always then you see, am I a nurse? I don't think I've forgotten that I'm a nurse. So, you see, that is the time. For example, if at that time, if I don't want to claim or don't admit myself as a nurse, I don't go forward, am I wrong?
Yes.
Am I wrong? Can you bring me to the court?
No.
So this is always the dilemma. Firstly, I'm not in uniform. I'm off duty. Yeah, that is why for nurses, for even our student nurse. Last time, if you remember, our student nurse always come in the class, even in class in uniform, and they walk everywhere with uniform. Yeah, they go shopping mall, they go everywhere. So then we always tell our students they are not allowed to go in uniform anywhere, because when you are in uniform, people will think that you're on duty. So if I'm in uniform, if I don't react, I think I'm wrong. Yeah. But during that situation, if I don't come forward, okay, we will see ethical and then your own moral, your own awareness, your own values that come different. Yeah. But if I don't go forward, I don't think anyone can sue me. Yeah. But deep in me, my own ethical, my own value, my own human, your own conscience, your consciousness. How? If there's no doctors on board and you are the only person, and then you don't go forward, so how? So I think generally we will still you feel guilty, isn't it? What if you can do something? If you can do something to save or do something, so of course I think we will go forward. But I always have questions that people ask. If I go forward, if something happened and the victim died, then how? So if they want to, if anything, they want to bring a case, of course then you will not be, if they want to bring a case, you will be involved because you are there. So again, that's why here, the question is who will provide CPR? The answer is anyone who is ready, who is willing, and who is able to provide CPR. But I hope after this, all of us, when I say willing, anytime, next time it happens to you, that people ask for help, and then you don't pretend you know. I'm not willing. So I hope you are willing, I hope you are willing.
You need to take risks.
But in case kalau kita tolong, then dia tak berjaya kan? So ada family members tu
Okay, to be honest, so far I have not, maybe you're also in healthcare, most of you, my colleague, have you heard of any case that actually people sue us because failed CPR? Actually no, I have not encountered any. So those like our Jessie, Kalai, Shantini working in ED, have you no?
If we do and suddenly happen like example like we push too hard, the rib fracture or what, then it's
okay, the rib fracture is actually because of the skill that is wrong. But sometimes, Yeah, which one fracture ribs it can heal, but you lost a life. There's no take two. You cannot reverse. Yeah, but fracture can heal. So which one you weigh? Which one? Yeah. Yes. Yeah. Yes.
But sometimes you push too hard, the rib fracture,
okay, that is of course you don't want to happen now. That's why we learn
High quality.
we learn high quality CPR. That is why high quality CPR is important. Yeah, yeah. That's why we want people who are trained. Yeah, even like sometimes you call like you know, especially in the Western world, they may call for help when the emergency response team not able to reach fast. They may go over the phone. They may guide the first person, the first person that who witness how to do. I will come to that also. If you really not trained, and we can actually do hands-only CPR, right? Actually, will also increase the survival.
Ada dah cerita dan drama.
Yes.
And
also, I want to say, even after you learn CPR, whatever you see in the drama, most of the time, the drama is not correct. So that's why, then later you see macam-macam position, any position you see, that is not correct. So after we learn, that is drama. Drama is drama. In real life, cannot.
So in case, is there any precaution for osteoporosis bone?
Precautions. Precautions, yes, but then of course it must be from young. Yeah, like for my age now, example baru I want now only I said I must have a very rich calcium. Then I pump myself with a lot of milk about. That is actually absorption is maybe less already. So it's from young. That's why we always say that even like your young children, so don't stop them. You know, when we say that, oh, you are already 4 or 5 years old, you should stop milk already. No, don't stop them. Let them have their milk. But of course, drink, not from the bottle. You know, bottle. Yes, we have the children. 6 years old, 7 years old, still with the teeth. Yeah, so you change. Drink from the cup, but don't stop them from drinking milk. It must be from young. Then for all the women, of course, we know after menopause, our risk is increased. So we must have our supplement line, somehow. It helps a bit.
If it occurs inside your home, where there is no proper ventilation, should we need to bring the patient outside the ventilated area, or we can open the windows and something like that?
You mean when this happened?
Yes.
Okay, that's why we always we do not want too many persons that crowded in the place. So if you really happen there and you need to react, you need to act fast. You have no time to change the yes. But of course later we will come to that. The place must be safe. I will come to that. See, this is all very good learners. They ask questions ahead. That's why I go to that. Yeah, they ask questions ahead. Now I also keep to thinking.
So any law or protection for the healthcare provider, in case we willing and we done it, but the patient died. So in case any way of protecting the healthcare provider, because
very good. There's no laws or what to protect us, but all the especially in hospital setting, the hospital, the healthcare provider, the doctor, the nurses. Actually, we have insurance. Yeah, we have insurance, indemnity insurance. So if things happen, so yeah, that one will come in.
so now when we certified, we get that insurance because
the challenge, But I like this, because all these, actually many will feel like that, whether should I help or should not help. But trust me that so far we have not seen any vice, when you pass by any this patient collapse or victim collapse, then we help, like in the roadside, accidents, and then these passerbys, they go and help. So far, you see in the social media, everybody become hero. Very good, very good, so far, they never actually bring you to court or sue you because of your helping. Why, in the patient collapse you help. So far, no. But in hospital practice, of course, there are many other consequences, many factors. They may, if some negligence happen or some malpractice happen, of course, they can bring to the court. But bring to the court for medical, legal, it's not easy for the patient to win, for the family to win. Yeah. But of course, they can bring to the court. There's a hospital, they will have this indemnity insurance, and for the doctors and nurses. Yeah. So like, for example, for this case happen, of course, you need to go through. It's not easy, but of course there are cases that the patients or the relative win. Then you will get compensation, a lot of money they will get. But that one is different case. Yeah. Okay, can we come back here? Yeah. Otherwise, but it's okay. It's good that you all give. But then you can see that there's a different of lay rescuer and the healthcare provider. Always ahead. That's why your question also will be one step higher. And I know some of you are not in clinical practice per se, like you don't really handle patient. And then in the hospital setting also, usually who care for the patient 24 hours is the nurse. And then during resuscitation, the doctors will be there. Even though you may not have experience involved directly, for this practice, we decided, we will still let you handle. We will show you with MU bag. Later we will show you. So you will still handle MU bag, especially for 2 men. So we will reduce the mouth to mouth. So we will use the MU bag. So you will have a try, have a hands-on experiential learning using MU bag. But in the hospital setting, usually it's the nurse and the doctors will be the one handling. But for this practice, we will let you handle MU bag. Usually for lay rescuer training, we will not include MU bag. But for you, you will include MU bag. Yeah?
But that's okay, but when the MU bag is not available, how do they, we must know, right? How
I'm coming to that. Okay, that's why I'm a student. Okay, so we will before I go into the steps, so let's review some of the guidelines from AHA. So this is 2010 guideline. It's still used until today. So last time, if you remember, I think those days, especially like those had experience before. Last time when we talked about CPR, we talked about ABC. But since 2010, AHA already reviewed this sequence, not as ABC, but we go to CAB. And then in NCOT, they still do this, look, listen and feel. Where they actually put their head down, they look, they listen and feel. We also take this step out. But it's not to say that we don't do assessment, we do assess, but we will use another way, I will show you later. Because we want to save time. We want to start CPR within 10 seconds of recognition of cardiac arrest. We want to save fast, because we know 4 minutes, brain death, brain death will take place. So here, in 2010, we already changed to CAB. Instead of ABC, from today, these 2 days, we will do CAB, CAB. C stands for compression, A for airway, B for breathing. So we will see this video.
Sorry?
Yes.
Because C AB, right? Because the first for circulation, we have to, in case any bleeding or something, or else we have to.
Okay.
That will be different.
In this case, in here, more we focus on cardiopulmonary arrest, CPR. For those who have problem with the heart and lung. Yeah. In case, for example, this is not trauma, because like you said, bleeding and all that, that will be trauma case already. So they may have, of course, in emergency, we have trauma. Yeah. So if trauma case, then of course it's different. And trauma case means that maybe they're accident. So the problem is actually bleeding. Yeah, bleeding first. Yeah, bleeding, and then the patient may be still conscious. Meaning to say, I still breathe my own. My heart is still pumping. It's because my problem now is bleeding. But of course, if you don't treat the bleeding, you don't stop the bleeding, if the bleeding is massive, then it will affect the circulation system. Then the patient will go into shock. You go into shock, the patient will collapse. If patient collapse, your CPR will come. Yeah, that is the difference. Yeah, but now we will leave the trauma case. We will focus on this patient who has. When you start CPR, is regardless of what, is when the heart stops, when there's no breathing. Breathing means no spontaneous breathing. They are not breathing. So then we will stop. We will start CPR. So here we will see this.
The American Heart Association is the nation's leader in life-saving CPR training. In fact, we write the CPR guidelines for everyone, the public, doctors, nurses, and paramedics. This year, we've made a few changes so that it's much easier for anyone to save a life using CPR. Let's take a quick review of the new CPR process and when to use it. When someone's heart stops beating, it's called cardiac arrest. CPR is needed right away when this happens. Cardiac arrest victims will die if they don't get help fast. When cardiac arrest strikes, the victim typically collapses, stops breathing, or stops breathing normally and can't respond. If the victim does not respond, and the victim is not breathing or not breathing normally, yell for someone to call 911 and have them get an AED. An AED is a portable electronic device that helps the heart return to its normal rhythm. If you're alone, call 911 and get the AED yourself. Then follow the AED's voice prompts. If no AED is available, immediately start CPR, beginning with compressions. Doing CPR is not hard. Anyone can do it. And now the American Heart Association is making CPR easier than ever. We used to tell people that the proper steps for CPR are airway, breathing, compressions, or ABC. But we've changed that order, so the compressions come first. It's now compressions, airway, breathing, or CAB. This new order makes it easier because anybody can start out with compressions, even with no CPR training. Just push hard and fast on the center of the chest. If you haven't been trained, keep pushing until help arrives. When you give compressions, make sure you push the chest down at least 2 inches and allow a little time for the chest to come back up. Push as hard and fast as you can. The perfect rate for compressions is at least 100 per minute. That's the same speed as the beat of the song Stayin' Alive, so try to keep that tune in your head if it helps. If you've been trained in CPR, push on the chest 30 times, then open the airway by tilting the head back and lifting the chin. This helps air reach the lungs. Next, give 2 mouth-to-mouth breaths over 1 second for each breath, and watch for the chest to rise. Continue the CAB cycle until help or an AED arrives. Use the same CAB cycle for adults, children, and infants. This is just a quick overview. So to learn more or to sign up for CPR
Okay, so this is CAB, and we are going to do this. And this afternoon, you will do mouth to mouth. That's what. And we will give you a shield, don't worry.
Miss Pat, in case kalau patient tu ada airborne disease, kita bagi more to much infection kita.
Okay. Now, I will come to that later. So, so I have questions. Okay, we'll come to that later. I will answer that when we come to that, yeah? We will keep the question. So, this is the highlight of 2015. Just like 2010, we changed to CAB. So in 2015, we have separate chain of survival. They have been recommended to identify the different types of patients that in hospital and out hospital, which is already covered by Kalai. So, and here, high quality CPR continue until today. And I will come to next slide. Yeah, next slide will be high quality CPR. Yeah. Mentioning high quality CPR, mana high quality CPR? Is it okay? Coming. So the recommended chest compression rate is 100 to 120. Last time, 2010, they said at least 100. Now they said must be 100 to 120. And they clarified the recommendation for chest compression depth for adult. At least 2 inches or 5 centimeters. This is part of the high quality, 5 centimeters or 2 inches, but not greater than 2.5 inches or 6 centimeters. Okay, now we will come to high quality CPR. Then I will mentioning for the high quality CPR, what is it? Number 1, start compression within 10 seconds of recognitions of cardiac arrest. That's number 1. Yeah, that's why we need to do our assessment fast. We need to recognize cardiac arrest fast. And within 10 seconds of recognition of cardiac arrest, we must start CPR. And after you start CPR, we recognize the cardiac arrest, start CPR, let's talk about compression first. Because the first is compression, C, compression. Push hard push fast. The compress at 100 to 120 minute per minute. Yeah, 100 to 100 times per minute. That is the rate. What about the depth? The depth is at least 2 inches or 5 centimeters in adult. At least 1/3 the depth of the chest, or about 2 inches for children.
Same like
Okay.
children, same
Yeah.
like adult.
Okay, adult and children same, but actually you look at the size, yeah? So your strength will be different. Yeah, okay? And at least 1/3 anterior, posterior, 1/3 of the depth of the chest, or what we say anterior, posterior. So the baby is not here, yeah? Baby. So you see, okay, look at me here. This is anterior, this is posterior. So you actually draw an imaginary line. So in this depth, so you go 1/3. So if divide into 3 is 1/3. Yeah, 1/3. Or 4 centimeters for infant. That is for infant. And infant, of course, the hand placement is different. For adult, for kids, for children, you use this, the palms of the heel of the palm. But for infant, we only use 2 fingers. Yeah, 2 fingers. Still, yeah, continue. That is, okay, number 1, high quality CPR must start CPR within 10 seconds of recognition of cardiac arrest. Then we talk about the chest compression, push hard, push fast. The rate is 100 to 120 per minute. For adult, the chest depth is 5 centimeters. And then for infant, 4 centimeters. Then allow complete chest recoil. Chest recoil means, if you remember, we compress already. You must let the chest come back, then only compress. Yeah, you must have the complete chest recoil. Don't do like this. Yeah, you do like this, you just make the heart like that. So the heart is not enough circulation. Yeah, what the heart pumping, it should be like that. Okay, that is only a good pumping. If you make the heart like that, the heart is just like, so it will not be good. The blood circulation will not go up. Okay? And minimize interruption in compressions. Try to limit the interruption to less than 10 seconds. So we also practice this. We don't want interruptions during the CPR. And give effective breath. Now, talk about when you start within 10 seconds of recognition of cardiac arrest. Then talk about compression. Push hard, push fast. The rate is 100 to 120 per minute. The depth for adult is 5 centimeters. Then you allow complete chest recoil. Then next, minimize interruption. Then you go into respiration, ventilation. So give effective breath that make chest rise. So how you want to make sure that you have given enough breath or enough ventilation? Observe for chest rise. That's why for adult, if you use mouth to mouth, you need to blow harder because the lung volume for adult is more. So you need to give more air to make the chest rise. For baby or for infant, less. Because they don't need so much volume to get the lung expand. And you give more, you will cause problem to the baby. So how we want to know sufficient? Look for chest rise. Yeah? And all our mannequin observe chest rise, including baby. So later on, afternoon, when we're hands on, we must see chest rise. Tomorrow exam, we must see chest rise. And avoid excessive ventilation. This is what I meant. Just how we know that it's sufficient, chest rise. And this question can be asked in MCQ. How you want to make sure that the chest, the ventilation is effective. So you see for chest rise. Yeah. The cycle should flow. Yeah, you cannot that do after compression already. Do what? Then this is interruption. Or later on, when you have 2 people, you want to change, you only change or switch role at a certain time that is suitable. We will come to that in 2 men. You cannot just say that contoh, for example, we are still in the cycle. Then suddenly you say change. Cannot. We do not want this interruption. So when later on when we practice also, we will practice the whole thing, the flow. And a good one, 5 cycle, will take actually about 2 minutes. 5 cycle means compression, ventilation, compression, ventilation. It will take about 2 minutes. Then it should continue until we will come to that. Until when we will stop. Okay, so these are the high quality CPR. So not only we will see this, we will observe this during the practical exam. It can also be asked during the theory exam in MCQs, and during your practical exam, the examiner also may ask you to see whether you still remember this high quality CPR or not. 6 steps. So now we will see.
On any given day, you could come across a victim of cardiac arrest, where your actions and training can determine the outcome. Today, we'll review the key elements of providing basic life support to adults, children, and infants. This will include both CPR skills and AED use, as well as how to help a victim who is choking, and a discussion of special considerations. High-quality CPR improves a victim's chances of survival. There are several critical elements of high-quality CPR you should remember. Start compressions within 10 seconds of recognition of cardiac arrest. Push hard, push fast. Provide compressions at a rate of at least 100 compressions per minute and at a depth of at least 2 inches or 5 centimeters for adults. Allow complete chest recoil after each compression. Minimize interruptions. Try to limit interruptions in compressions to less than 10 seconds. Give effective breaths that make the chest rise. Avoid excessive ventilation.
Okay, I will stop this. That is the 5 high quality CPR. And later on when we go into assessment, then we do compression, then ventilation. So I will skip this. This video actually will tell you will show you the whole thing. But later you will see again. I will skip this for now. So here, still in the highlights of the 2015 AHA guideline, they said untrained lay rescuer should provide compression only or hands only CPR until the arrival of the AED or rescuers with additional training. And trained rescuers are encouraged to simultaneously perform some steps. This is where we do away with this look, listen, and feel. We will simultaneously doing this. We will check for respiration, check for breathing, and check for pulse. So we will come to that later. We will practice to reduce the time of first chest compression. And for witness adult cardiac arrest, when the AED is immediately available, it is reasonable that the defibrillator to be used as soon as possible when the AED arrives. This one will tell about hands-only CPR.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest. Then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song Staying Alive.
Have you heard about this song? This is the tempo, Staying Alive.
Let's hope you never have to use hands-only CPR. But if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life. To learn more, call 877-AHA for CPR or visit park.org/hands-only CPR.
So the importance of early administration of CPR by the rail rescuers has been re-emphasized in 2020. Now from 2010 we go to 2015, now 2020. So we emphasize again this early initiation or early recognition of cardiac arrest and then initiate CPR by the lay rescuers. Now this one is inside the folder that I shared, yeah? So here is everything, a summary of, this is a summary of all the steps from scene safety. Number one is scene safety, meaning to say we must make sure that the scene is safe for us to perform CPR. Yeah, we are there to help, yeah, not to give up our life. So you make sure that it's safe environment, yeah, for the victim and for the rescuer. Then recognition of cardiac arrest. This is what we will also see next in the next slides. So how to recognize cardiac arrest, and then activation of emergency response system. So in Malaysia, what should we call? What number? 999 for ambulance. Because 999 is actually for all. We bombard also 999, the police also 999, so you must tell 999 for ambulance, otherwise bombard will come. So then ambulance is not there. And then compression to ventilation ratio. So you can see there's 3 columns here. The first one is for adults and adolescents, for children age 1 year to puberty, and then for infant. For children and infant, it is same, similar. On the same thing, yeah. So here you look at the compression ventilation ratio. For 1 or 2 rescuer, no difference for adult. 30 compression to 2 ventilation. 30 compression, 2 ventilation. 30 compression, 2 ventilation. It doesn't matter whether you are doing alone or there's a team or there's 2 persons. But for children and infant, if you are alone, 1 rescuer, it will be 30 compression to 2 ventilation. But if it's 2 rescuer, we will half the compression. The ratio become 15 compression to 2 ventilation. This one, question will ask, yeah? Yeah? The question will ask, So for infant, what if 2 rescuer? What is the ratio of ventilation to compression to ventilation? 15 compression to 2 ventilation. But for practice, we are not going to practice 2 rescuer. Adult, yes, we will do 2 rescuer. For infant, we will do 1 rescuer. 1 rescuer means 30 compression to 2 ventilation. And the hand placement will be a bit different also for 2 rescuer. So here, yeah, this is the, and also sorry, I missed this, for activation of emergency response, for adult, you can just leave. If you don't have a cell phone, now it's very easy, everyone have a cell phone. So if you are alone, you have no cell phone and you need to go and call for help, so you can leave the adult, go and call for help, then come back to start CPR. But for infant or children, if this is an unwitnessed collapse, means to say you do not know what happened to this child or this baby, and you have nobody with you, no one can help you to call. For adult, you can leave to call for help. But for infant, you cannot just leave like that. You must provide 2 minutes CPR first. Then only you can call. Now, if you remember the chain of survival for pediatric, for children, the first one is prevention. Because usually when cardiac arrest happens to a child or a baby, usually it's respiratory origin, not from the heart. For adult, usually it's because of heart attack. But for children, usually it's respiration. It's the respiration problem. So that's why you please provide 2 minute CPR first, then only call. But now this issue actually can be resolved easily because everyone have a cell phone. You can quickly call. Yeah? Yeah, so you can quickly call. But now everyone have a cell phone. Who have no phone? We have a mobile phone with us. At those days we don't have mobile phone. That's why in the latest guideline, they also put in the mobile phones. When you have mobile phone, you can just call and then like that. So in here, but this one, still one question can ask. because since we are using 2020 guideline, yeah, so this is still in the 2020 guideline. If this happened to a child or to an infant, unwitnessed, you do not know what happened, and nobody with you, what you should do first, 2 minutes CPR before you call. Question can be asked, both practical and theory. And then another important difference is 2 or more rescuer. The ratio for compression to ventilation for infant and children become 15 compression to 2 ventilation. Then of course, this is all the compression rate and depth. All this is the high quality CPR. And hand placement for adults and adolescents, 2 hands on the lower half of the breastbone or sternum. Here, this is the sternum. So it's actually in the center of the chest. So you put here, the sternum. It's on the bone. We're actually compressing on the flat bone, not the ribs, the ribs at the side. So that's why when you fracture the ribs, it's because of the wrong hand placement. So it's actually on the flat. This is the flat bone, actually. This is the sternum. So it's actually on the sternum. And then for children children can be at least, sorry, under my hand placement, okay. Here, children, you look at the size, that can be 2 hands or 1 hand. You know, like usually like for the children, even in Arabs, I see their children, the children, the size is big. For our Asian, maybe smaller size. But if a smaller size, then of course, if you feel like 1 hand, 1 palm is sufficient, you use 1 palm. If you see that, you know, even our children now also, because of the food there, we feed very good food there, and then fast food, so everyone is big size, even they are young, for them, even 9 years old, they are actually like adult size already. So if in that case you do, in 1 hand you feel like it's not too tired and not sufficient, you do 2 hands. But for infant, definitely, no matter the baby chubby or not, so you still use 2 fingers. But if 2 person, to be honest, we will practice, we will use 2 fingers because you are alone. But in the hospital setting, we always have many people. And trust me, I will not use 2 fingers because we have many people. We still use 2 fingers, but we will encircle the baby. So we will use the thumb, this way. This way. Still finger, but we will use this way. Later I will show you during the station. But for practice, we will use one man you will use 2 fingers. Okay, after that, okay, this is what we are going to practice. 1 rescuer CPR, 2 rescuer CPR, infant, adult choking, infant choking, use of AED. So the age definition, just to recap a bit, just now you already learned, adult is adolescent, or after the onset of puberty and older. So what is puberty? For sign of puberty for male and female?
Sorry to interrupt. Actually, for look, listen and feel, what is the alternative?
Okay, I will come to that later. Very fast, haven't come to the step. Okay. Now we will just learn the guideline first. Okay, I will come to that. So here, puberty in male, hairy chest, then of course, all these you know, So sign of puberty include chest of underarm hair and in male. And then then for female is the breast development. But of course for our Asian, we may not see a hairy chest in male. It's more for Western. Or maybe in Malaysia, maybe we'll see more on Indian. Less in Malay and Chinese. So if you see a Chinese or Malay, then no hair here, you don't say that it's still a baby. So underarm is usually, that is common, underarm, But also difficult now, because now people don't want to have hair, and then they go and remove all the hair. Anywhere they go and remove. Not only perempuan, not only female, male also go and remove. They remove hair everywhere. They don't want hair. But they must know that is important for hair. You know, sometimes here also they go and remove. There is a reason why the hair is there, or even inside the nose also we have some hair. There is a reason you don't go and botak your hair inside. So botak means a bow. So here, this is the basic framework for CPR. Of course, we are here for if for the hands-only CPR for those no training, those who are trained, yeah, we can go for more. Yeah, and of course in the hospital we need a multi-rescuable coordinated CPR. That's why when you go up the hierarchy, you go up this pyramid, more training required. Okay, this is the barrier divide. This is one that I want to answer once the questions. So, of course, when you are outside, when you are outside, say for example, you are outside in a public area and then somebody collapse, and this is not someone that we know, it's not our friends, it's not our family members, it's strangers. We also do not know what disease they have. So, do you want to do a mouth-to-mouth direct? No. So it's not advisable. It's not advisable because we do not know them. Unless you don't mind, you want. And actually when you ask, of course under OSHA in 2020, they said the risk for getting infections through CPR is actually very low. But of course now we have so many contagious diseases that we do not know, and then airborne and all that. So we, of course we take precautions. Yeah, that's why in outside, if it happens, if you ask me, I will also not provide direct mouth to mouth. But if this is your friends or this is someone you know, and if you want to provide mouth to mouth direct, but you still feel uneasy if you go direct, so what you can do? You can actually use anything like a scarf, your tudung, something soft or handkerchief, just put on. But of course it's not too thick lah. If you thick, then the air cannot go in. Or if you feel like you want to buy this, this pocket mask. And last time I used to keep in my car. But because of this is silicone, so when you put under the hot sun, so sometimes it gets spoiled very easily. Yeah. So if you have this pocket mask, and it's not expensive, I think 30 or 40 ringgit. So if you can get this mask, and it's actually pocket mask, and it's very handy, and you can carry it with you if you want. Last time I used to keep this and also glove in my car behind the boot. But then you see now, park under the hot sun and Malaysia punya climate, no need 1 week, less than 1 week, all this will be spoiled. Yeah, your glove also cannot be used. So if you feel like, maybe after this you feel like, I will get ready in case anytime, then you may want to get, and you can get this. And this one is actually with mouthpiece, and this is with a valve, and it's only one way. One way means when you blow, the valve opens, the air will deliver into the victim, and you will not be able to suck back. Don't worry, you will not suck anything back. You won't suck back. This is one way. So this is to answer the question is actually very, the risk is less. And in the hospital, of course, our risk is even less because we will not do mouth to mouth. We will use MU bag. So in the hospital. So later in the afternoon we will try MU bag. But because we also want to train you, you can see this. We also want to make sure that you have the skills. So we will give you a shield. The shield also is actually one way. Yeah, we will give you a shield. Later we will give you a shield. And it's disposable. Don't share your shield with others. So we will give you a shield, and then after lunch we will give you some instruction. You must go, for those ladies who use lipstick, you must remove your lipstick and then go and gargle, so that later when you blow, the vegetable never come out. Okay, so that one later.
Why vegetable?
Why vegetable? After lunch. Of course, we do not want anything that from your stomach that suddenly come out. So then you choke, then you have live model. Then you have live model. So agonal gaps. This one I will just go quickly. This is not a normal breathing. This may be present in the first minute after sudden cardiac arrest. And a person who is gasping usually looks like he's drowning in the air quickly. You can see, you can still hear this noise, but this is not breathing, not a normal spontaneous breathing. So people may mistakenly that, oh, this patient or this victim still breathing. Actually not. And when you see them gasping, you should start CPR. Okay. So the victim's mouth may be open and the jaw or head or neck may be moving. So they will have this movement and you think that they are breathing. Actually it's not. So in this case, yeah, this person, they need CPR because this is a sign of cardiac arrest. So we will see this patient, John.
This is Joe.
Not John, Joe.
He's about to have a cardiac arrest. You can save his life. Will you notice the signs? The first sign is straightforward. Joe collapses. He's unresponsive. His body limp. Now this is the part where it gets tricky. You see, this isn't breathing, nowhere near close. The lungs are gasping for air, but they can't get to it. The heart has stopped, the brain is trying to breathe. He needs CPR. The last sign? The skin will change from pink to blue, and finally turn cold and grey. This is Joe. He's just had a cardiac arrest.
Okay, we don't wait until the whole bill, then you have, and when I always say it, the patient's heart rate go down, your heart rate will go up. Because you are getting more and more stress, especially in the hospital.
So Ms. Macam when we relate this video with the earlier yang video dekat Indonesia tu, meaning that bila pemain tu dah collapse, within 10 seconds.
Yeah, within 10 seconds they actually should assess. There's no pulse. No pulse, that is to answer the question. We don't look, see, because we will check pulse and we will check for breathing simultaneously. No breathing, no pulse, we will stop. We won't wait ready. Yeah. So here we will use these for this from now onwards. You will hear me saying Dr. Cap, DRCAB. This is the quick guide for you to perform CPR. So D is away from danger. D stands from danger. So away from danger. This is scene safety. Then R is, here there are 3 things that we want to do. First, check for responsiveness. So we will show later in the next video how to assess to check for responsiveness. Responsiveness means we want to call the person or the victim, see whether they respond to us or not. For adult, we will usually tap on the shoulder. Yeah, hello, hello. So how to tap later we will show. Yeah, and we want to make sure that this person is collapsed, is not sleeping. So who knows that actually they are resting and just nicely sleeping, close their eyes, and then suddenly you go there, without checking, and then you go and compress, want to give CPR, and he will immediately open eyes and give you a box, give you a punch. Yeah? Okay, so we want to make sure that this person is not responsive. And then we will check for respiration and pulse together. If there's no pulse, no respiration, then we will call for rescue. Rescue, help, call 999, bring AED. Call 999, we ask the next person to call for emergency response team. Call 999 for ambulance. Help, call 999 for ambulance and bring AED. AED means you go, you must know like if it's surrounding there is AED, and you see now most of the places there is AED. Then bring the AED, come back. Okay? Then CAB, compression, airway and breathing. So now we are coming to the steps already. Yeah? First, we want to learn how to do assessment. You will watch this video and you have a question, then we will verify later.
Coming through, stand back please. Scene is safe.
The first step of BLS is assessment and scene safety. The first rescuer who arrives at the side of the victim must quickly be sure that the scene is safe. The rescuer should then assess the victim for a response and breathing.
Hey, are you okay? Can you hear me? He isn't responding. Isn't breathing normally, just gasping, grab the AED.
If the rescuer is alone, he or she would then call for help and get the AED. The next step is to check for a pulse. To perform a pulse check in the adult, feel for a carotid pulse.
No pulse.
This technique is usually easier to perform on the side near the rescuer. Locate the trachea using 2 or 3 fingers. Slide these fingers into the groove between the trachea and the muscles at the side of the neck, where you can feel the carotid pulse. Perform the pulse check for at least 5 seconds and no more than 10 seconds. If you do not definitely feel a pulse, immediately begin CPR, starting with chest compressions. CAB sequence.
So how you assess for responsiveness first? D, for away from danger. Then check for responsiveness. For adult, you tap on the shoulder. Hello, hello. In the video, of course, you see hey, hey, yeah. But here we don't want hey, hey, yeah. Hey is this. So we hello, hello. You can say because you do not know the name, yeah. And no need to say what is your name, okay? Just tap, yeah. Just tap. Yeah? If they can answer you, you don't need CPR already. Yeah? So you just tap on the shoulder. Hello, hello. Are you okay? If the person can hear you, they are breathing, of course they will open their eyes. If you hello, hello, are you okay? Hello, hello, are you okay? No response means unresponsive. But hello, hello, you want to tap, you need to use some energy lah. Yeah? Jangan hello, 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 then in deep sleep they never get up. And not also hello, hello. So adequate strength. Okay, hello, hello, are you okay? Unresponsive. Then check for pulse. So how to check for pulse? You can check for your own pulse. Feel now for your pulse. In the center, the trachea, you go to the groove. Either side, yeah, you can feel the pulse. This is what pulse? Carotid pulse, yeah? So question can be asked. For adult, where you want to check pulse. So what is this pulse? Carotid pulse. So you check for pulse, and then at the same time simultaneously, check for, observe, use your eye, observe the chest rise. So when you are breathing, when you breathe, of course you don't really see, but when, of course if I just go near, then suddenly they say, why you're looking at me, then I will stop. Actually it's spontaneous, you can see chest rise. So you see for chest rise. So simultaneously, for 5 seconds minimum, not more than 10 seconds. Why not more than 10 seconds? Because we want to start CPR within 10 seconds of recognition. So we will do a 5-second check. 1 second, 2 seconds, 3 seconds, 4 seconds, 5 seconds. Because you don't have watch, how you want to see, you will count. 1 second, 2 seconds, 3 seconds, 4 seconds, 5 seconds. No pulse, no respiration. Start your call for help first. Yeah, call help. Okay, you call 999 for ambulance. Get AED. So if you have no time to call, what is your name? Just point. You call 999 for ambulance. Ring AED. Then you start your compression. Okay. So I repeat for assessment. Next, hello, hello, are you okay? Hello, hello, are you okay? No response. Check for pulse, check for respiration, check for pulse, check for respiration simultaneously. Then, give the instruction to call for help, call 999 for ambulance, bring AED. Start.
Within 10 seconds.
Yeah, within 10 seconds, but we will check for 5 seconds. Yeah, because we want to start fast. So after that, this one, we will see how to do chest compression.
Now we're going to learn how to do chest compressions. Just watch now. We'll practice momentarily. Position yourself at the victim's side and make sure that the victim is lying face up on a firm, flat surface. Quickly move or remove all clothing from the front of the chest. You will need to be able to see the chest and later attach an AED to bare skin. Put the heel of one hand on the center of the bare chest over the lower half of the breastbone. Then put the heel of your other hand on top of the first. Your shoulders should be right over your hands and your elbows should be straight. Push hard and fast. Press down at least 2 inches or 5 centimeters with each compression. This requires hard work. For each chest compression, make sure you push straight down on the victim's breastbone. Deliver compressions in a smooth fashion at a rate of at least 100 compressions per minute. At the end of each compression, make sure you allow the chest to recoil completely. Chest compression and chest recoil times should be approximately equal.
Position on a firm surface. Properly performed CPR produces only 25 to 30% of normal blood flow. Doing compressions correctly is very important. With your shoulders directly over the chest, press straight down. Compressions should be regular and smooth, half compression, half relaxation. A
A common error is the rocking chair technique, where compressions are done from the side instead of straight.
So this station will be on infant CPR. So before I start, any one of you have any health issue that you are not able to, you think you are not able to stand up, okay, yeah? The one, I think she's okay. Yeah. So I will do the demonstration first. I will demonstrate on how to perform CPR on infant, and I will appreciate that you don't interrupt the session, because remember, high quality CPR, we don't want interruptions. And if you have any questions, you keep to the end of the session. Yeah. So for example, now we are jogging in the park, and then suddenly one mother called for help because her baby stopped crying and not responding. So from there you will start to help, because the call for help you are there. So remember our doctor, BRCA. So go to the mother, pedal, unpack, I know CPR, I can help. D, away from danger, put the baby on a flat and firm surface, check for response. Baby, are you okay? Baby, are you okay? No response. Check for pulse and respiration simultaneously. 1 second, 2 seconds, 3 seconds, 4 seconds, 5 seconds. No pulse, no respiration. Madam, call 999 for ambulance and get AED. Head tilt and start your compression. Dr. Cap DRCAB. Minimize interruption, high quality CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Head tilt, chin lift, cover mouth and nose. 2, 3, 4, 5, 6, 7, 8, 9, 10. 2, 3, 4, 5, 6, 7, 8, 9, 20. 2, 3, 4, 5, 6, 7, 8, 9, 30. Head tilt, chin lift. 3, 2, 3, 4, 5, 6, 7, 8, 9, 10. 3, 2, 3, 4, 5, 6, 7, 8, 9, 20. 3, 2, 3, 4, 5, 6, 7, 8, 9, 30. Head tilt, chin lift. 4, 2, 3, 4, 5, 6, 7, 8, 9, 10. 4, 2, 3, 4, 5, 6, 7, 8, 9, 20. 4, 2, 3, 4, 5, 6, 7, 8, 9, 30. Head tilt, chin lift. 5, 2, 3, 4, 5, 6, 7, 8, 9, 10. 5, 2, 3, 4, 5, 6, 7, 8, 9, 20. 5, 2, 3, 4, 5, 6, 7, 8, 9. Head tilt, chin lift. So after 5 cycles, check for pulse and respiration again. There's no pulse, no respiration, meaning to say there's still baby still not breathing, there's no pulse yet. Continue CPR, continue 30 compression to 2 ventilation for another 5 cycles. So for another 5 cycles, we will check pulse again and check respiration. For example, there is already pulse. Baby already have pulse. Meaning to say the heart is beating. No respiration, no breathing. So if no breathing, we will give rescue breathing. So rescue breathing for baby, for infant, 1 breath in every 2 to 3 seconds. So you will get how many breaths? 20 to 30 breaths per minute. So we will practice 1 breath in every 3 seconds. So in 1 minute you will get 20 breaths per minute. 20 breaths per minute. Yeah? So say for example now, baby already has pulse but no breathing. So I will give rescue breathing. So head tilt, chin lift. 1 second, 2 seconds, 3 seconds, 2. 1 second, 2 second, 3 second, 3. 1 second, 2 second, 3 second, 4. 1 second, 2 second, 3 second, 5. 1 second, 2 second, 3 second, 6. 1 second, 2 second, 3 second, 7. 1 second, 2 second, 3 second, 8. 1 second, 2 second, 3 second, 9. 1 second, 2 second, 3 second, 10. 1 second, 2 second, 3 second, 11. 1 second, 2 second, 3 second, 12. 1 second, 2 second, 3 second, 13. 1 second, 2 second, 3 second, 14. 1 second, 2 second, 3 second, 15. 1 second, 2 second, 3 second, 16. 1 second, 2 second, 3 second, 17. 1 second, 2 second, 3 second, 18. 1 second, 2 second, 3 second, 19. 1 second, 2 second, 3 second, 20. So after 20 breath, check again pulse, check again respiration. If this time pulse already gone and no respiration, you go back to CPR 32 for 5 cycles. After 5 cycles, check again pulse and respiration. If there is pulse, no respiration, give rescue breathing. 1 in, 1 breath in every 3 seconds, you will get 20 breaths per minute. So after that, check again. If there is pulse, there is respiration, put the baby into recovery position. So you can turn the baby to the side, yeah, and then make sure you observe the baby and reassess the baby every 2 minutes. So if this is an unwitnessed collapse, you have nobody with you, only you and the baby, and you don't have cell phone, what you should do first? Yeah, we do 2 minutes CPR first, then only we call. So any question so far? If not, then no question, then we will practice. We will do together. We will do together. Yeah, get ready your shield. Get ready your shield. Your shield, you must see this face up. Yeah, otherwise then it will face up. Okay, this is where you will blow. Yeah. So for baby, I will suggest you to do it this way because you need to cover the nose and mouth. This also can. Yeah. Okay, this also can. You have bigger for you. Yeah. So this way. Yeah. Yeah, so you will cover the nose and mouth. Alright, so you can get ready your shoe, then we will start together, yeah? We will count together. Okay, so for example now, you are in the shopping mall, yeah? And then suddenly one mother call for help, the baby stop crying and not moving. So from there you help. So, what you do first? Together?
I'm physio. I know how to do CPR. I can help you. Okay, let me check your baby.
Okay, so let's go together. 1, 2, 3.
Baby, hello baby.
Okay.
Are you okay? Are you okay?
No response.
No response.
So in tomorrow exam also you do like that. We give you a scenario, you do. So no response. Then after that, okay, we will see, observe. Okay, put your on the brachial pulse. Okay, and then eyes on the baby. Okay, 1 second. We will say 1 second, 2 second, 3 second, 4 second, 5 second. No pulse, no respiration. Mother.
Mother call ambulance.
Mother 499 ambulance, bring AED. So we will start our compression. Remember high quality CPR, limit our interruption, and then make sure your compression depth, compression rate, and also complete chest recoil, enough ventilation. So when you blow, your eye actually see on the baby. Yeah? So head tilt, how to do head tilt? Head on your dominant hand, all right, your dominant hand all right, yeah? Okay, so the baby is okay, yeah? Otherwise you need to turn the baby. So your non-dominant hand on the forehead, and then this one is on this side, head tilt chin lift, okay? On the side, yeah? Not on here, yeah? The side, okay? Head tilt chin lift, then you blow, yeah? Okay, so all good. 2 fingers on the center of the chest, yeah? Actually lower half of the breastbone. Not on the tip, yeah, on the lower half of the breastbone. Of course here, this baby, actually in the picture also you can see, yeah, this is the nipple line. You see the nipple line? So it's actually 1 finger below the nipple line. Yeah, you see 2 fingers. Okay, all ready? So we will do together, yeah? Ready, yeah? Yeah, either way can, as long as it must be that this side is will be on your mouth. Yeah. Okay, ready? Yeah. We will start the compression, 30 compression to ventilation. We will count together. 3, 2, 1, go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30.
Head tilt, chin lift. Head tilt, chin lift. Lift your finger, head tilt, chin lift. Yes, then blow. Okay, must see chest rise out. Okay, good. Blanket punya sudah already got. Okay. By right, we should minimize interruption. So we cannot stand and correct, yeah, but practice. Okay, now. Two ready? Okay.
2, 1, 2, 2, 3, 4, 5, 6, 7, 8, 9, 10.
2, 3, 4, 5, 6, 7, 8, 9, 30. Head tilt, chin lift. Head tilt, chin lift. Cover nose and mouth. Blow. Must see chest rise. Okay. One blow and then take your head up. Then another blow. 3, 2, 3, 4, 5, 6, 7, 8, 9, 10. 3, 2, 3, 4, 5, 6, 7, 8, 9, 20.
3, 2, 3, 4, 5, 6, 7, 8, 9, 30.
Head tilt, chin lift, cover nose and mouth, blow. Head tilt, chin lift, cover nose and mouth, blow.
5, 2, 3, 4, 5, 6, 7, 8, 9, 10. 5, 2, 3, 4, 5, 6, 7, 8, 9, 20. 5, 2, 3, 4, 5, 6, 7, 8, 9, 30.
Okay, now after 5 cycles, we will check the pulse and respiration, yeah? So 1 second, 2 seconds, 3 seconds, 4 seconds. Let's say now we have pulse, but no respiration. So what we should do? Rescue breathing, 1 breath in every 3 seconds. So we will get 20 breaths in 1 minute. So let's do rescue breathing now together, yeah? 3, 2, 1, go. Okay, 1 second, 2 seconds, 3 seconds, 2. You count, otherwise you forget. 3, yeah, you do 3, that is number 3. 1 second, 2 seconds, 3 seconds, 4. 1 second, 2 seconds, 3 seconds, 5. 1 second, 2 seconds, 3 seconds, 6. 1 second, 2 seconds, 3 seconds, 7. 1 second, 2 seconds, 3 seconds, 8. 1 second, 2 seconds, 3 seconds, 9. 1 second, 2 seconds, 3 seconds, 10. 1 second, 2 seconds, 3 seconds, 11. 19. 1 second, 2 seconds, 3 seconds, 19. 1 second, 2 seconds, 3 seconds, 20. Okay, so 20 breath ready. We will check again pulse and respiration. If there is pulse, there is respiration. Recovery position and turn the baby to the side and we observe the baby every. Okay, turn to the side means that turn to us, turn towards you, so that you can observe the baby. If you turn the baby on the other side, you will not be able to see the baby's face. Turn towards you. Okay, so usually you can put a small towel behind. This one, in actual baby you will not, use it. Okay, yeah, you can put, yes. Okay, yes. Then we reassess the baby every 2 minutes. Yeah, if the baby suddenly stop breathing again, and no pulse, go back to CPR. Yeah, and if this is unwitnessed collapse, you are alone. What you will do first? CPR 2 minutes, then only call. Yeah, and when we will stop CPR, in when the blood connection will stop. too tired. Good. So now we will leave your baby first. Yeah, now we will move part police station. Afternoon. Anyone who have wait, stop first and then
Stop now.
So anyone who have any health issue that you are not able to stand for long, okay. Now for this station we will do on infant CPR, but I will do the demonstration first. So I will appreciate you don't interrupt my session because we want high quality CPR. And then if you have any question, you keep to the end of the session, then we will. Okay. So for example, now you are in the shopping mall. Nicely you shopping. Then suddenly one mother call for help because the baby stopped crying and not moving. So from there you help. Okay, mother, I'm paid. I know CPR. I will help. So take the baby, go back to your doctor cab, put the baby on the flat and front surface, away from danger, and then check for response. Baby, are you okay? Baby, are you okay? No response. Check for pulse and respiration simultaneously. 1 second, 2 seconds, 3 seconds, 4 seconds, 5 seconds. No pulse, no respiration. Mother, call 999 for ambulance and get AED. And I will start my compression and ventilation, high quality CPR. Make sure minimize interruption. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Head tip, chin lift, cover nose and mouth. 2, 3, 4, 5, 6, 7, 8, 9, 10. 2, 3, 4, 5, 6, 7, 8, 9, 20. 2, 3, 4, 5, 6, 7, 8, 9, 30. Head tip, chin lift, cover nose and mouth. 3, 4, 5, 6, 7, 8, 9, 10. 3, 2, 3, 4, 5, 6, 7, 8, 9, 20. 3, 2, 3, 4, 5, 6, 7, 8, 9, 30. Head tip, chin lift. 4, 3, 4, 5, 6, 7, 8, 9, 10. 4, 2, 3, 4, 5, 6, 7, 8, 9, 20. 4, 2, 3, 4, 5, 6, 7, 8, 9, 30. Head tip, chin lift. 5, 2, 3, 4, 5, 6, 7, 8, 9, 10. 5, 2, 3, 4, 5, 6, 7, 8, 9, 20. 5, 2, 3, 4, 5, 6, 7, 8, 9, 30. Head tip, chin lift, cover nose and mouth. So after 5 cycles, what we will do? Check pulse and respiration again. If there is pulse, no respiration or no breathing, so what we will do? We will give only ventilation. So this is what we call rescue breathing. So for baby, they will require more respiration, more ventilation than adult. So for baby, we will give 1 breath in every 3 seconds. So in 1 breath in every 3 seconds, in 1 minute, we will get 20 breaths per minute. So now we have this baby already got pulse, no breathing. So I will give rescue breathing. Head tip, chin lift. 1 second, 2 second, 3 second, 2. 1 second, 2 second, 3 second, 3. 1 second, 2 second, 3 second, 4. 1 second, 2 second, 3 second, 5. 1 second, 2 second, 3 second, 6. 1 second, 2 second, 3 second, 7. 1 second, 2 second, 3 second, 8. 1 second, 2 second, 3 second, 9. 1 second, 2 second, 3 second, 10. 1 second, 2 second, 3 second, 11. 1 second, 2 second, 3 second, 12. 1 second, 2 second, 3 second, I will check pulse and respiration again. So if there is no pulse, no respiration, we do start CPR back again, 30 compression to 2 ventilation for another 5 cycles. After 5 cycles, check pulse, check respiration. If there is pulse, there is respiration, put the baby in the recovery position. Turn the baby to the side. Yeah, turn to the side. So that you re-observe the baby every 2 minutes. Put something behind, yeah, so that, because otherwise the baby will turn back. Yeah, so put the baby on the side and re-observe the baby every 2 minutes. So when we will stop CPR, when the emergency team arrive, when the baby already regains consciousness and breathing. Number 3, when the rescuer is trapped. And if this is an unwitnessed collapse, you are alone, you don't have a cell phone, what you do first? For 2 minutes first, then only you call. This patient is very important, yeah? Tomorrow definitely eat, I can guarantee you, okay? Okay, yeah, so now we will practice together. Remember the high quality CPR. So you see, just now the cycle, yeah? After 30, I will go to ventilation, then start back the cycle. Don't wait. Okay? So tomorrow when you do alone, you have to the flow must be there. You remember high quality CPR, minimize interruption. So later on, please we will try to perform high quality. But of course, in practice, sometimes you have to wait for your friend. Then it's a big delay. But tomorrow, please make sure that once you have 30 compression, 2 ventilation, then quickly go back to your compression. Don't sit and wait or stand and wait. Okay, yeah? So we do together.
5 cycles, right?
5 cycles, yes. Okay, of course, I see, I do complete cycle for you. So tomorrow, usually we will let you complete the cycle first. But you are good, then we will prompt you. The examiner will prompt you. Certain things we will bring you ahead a step. Yeah. Then, contoh, for example, your rescue breathing, I can give you like after you give a few breaths already, I will say okay, 18. Then you do 18. We will skip a few. But otherwise, the first 5 cycles it will be complete. Okay. So now we will start. Yeah. So this mother call for help. Baby stop crying and not moving. From there you start. And before you handle the baby, talk to the mother first. Mother. You haven't checked the baby. You can do CPR. You can help. Because this is somebody's baby, you cannot just go and take baby's baby. Okay. Yeah. Yeah. So now. Yes. So then put the baby on the flat and firm survey. All this tomorrow you must talk, you must say, because that will be in the checklist. You don't do, we won't give you mark. Okay. So mother or father, I know CPR, I'm so and so, I know CPR, I can help. Then put the baby on the flat and firm surface away from danger. From there, not like this, Yes, baby, are you okay? Baby, are you okay? No response. Say no response. Okay, then check pulse and respiration, yeah? 1 second, 2 seconds, 3 seconds, 4 seconds, 5 seconds. No pulse, no respiration. For ambulance, bring. Mother, call 999 for ambulance and bring AED. Okay, then if you do together, your hand placement, no free hand, okay, get ready first, Okay, ready, we will go together, so that ready, 3, 2, 1, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Head tilt, chin lift, cover nose and mouth. Head tilt, chin lift, cover nose and mouth. Okay, head tilt, chin lift here. Head tilt, chin lift. Both hands also need to use. Head tilt, chin lift, yes. Okay, then blow. Must see for chest rise, yes. Okay, then second blow. 2, 3, 4, 5, 6, 7, 8, 9, 10. 2, 2, 3, 4, 5, 6, 7, 8, 9, 20. 2, 3, 4, 5, 6, 7, 8, 9, 30. Head tilt, chin lift, cover nose and mouth, low. 3, 4, 5, 6, 7, 8, 9, 10. 3, 2, 3, 4, 5, 6, 7, 8, 9, 20. 3, 2, 3, 4, 5, 6, 7, 8, 9, 30. Head tilt, chin lift, cover nose and mouth. Okay. 4, 2, 3, 4, 5, 6, 7, 8, 9, 10. 4, 2, 3, 4, 5, 6, 7, 8, 9, 20. 4, 2, 3, 4, 5, 6, 7, 8, 9, 30. Head tilt, chin lift. Cover nose and mouth. Low. Okay, never mind.
Okay, sure.
5, 2, 3, 4, 5, 6, 7, 8, 9, 10. 5, 2, 3, 4, 5, 6, 7, 8, 9, 20. 5, 2, 3, 4, 5, 6, 7, 8, 9, 30. Head tilt, chin lift, cover nose and mouth. Don't hyper extend the baby, yeah? You hyper extend, you also do the, also extend up. Okay. Time's up already, yeah? No. Baru saja. Okay. Sudah miss. Okay, now we do check the pulse and check respiration. If there is pulse, no respiration, rescue breathing. So 20 rescue breathing. Okay, get ready. Head tilt, chin lift. 1 second, 2 second, 3 second, 2.
After 3 seconds, ready?
Yes, 1 second, 2 second, 3 second, 3. Count, yeah? 1 second, 2 second, 3 second, 4. 1 second, 2 second, 3 second, 5. 1 second, 2 second, 3 second, 6. 1 second, 2 second, 3 second, 18. 1 second, 2 second, 3 second, 19. 1 second, 2 second, 3 second, 20. After 20, we check pulse and check respiration again. If there is pulse, there is respiration. Turn the baby to recovery position. Turn to the baby to the side and observe the baby every 2 minutes. Okay, now we will go quickly for choking, yeah? Okay, welcome back. So we have come to the end of the training. So congratulations, Tania. Semua sudah selesai your practical test and your theory test. So let's have our review, yeah, before we end the session. So remember, when we do what we have covered in these 2 days, apa yang kita belajar in these 2 days, we mainly focus on BLS. BLS for 1 man CPR, 2 man CPR, use of AED, infant CPR, and relief of choking for adult and baby. So now just recap, ya, apa steps yang patut kita buat when we recognize a person or a victim who have cardiac arrest. So remember this. Dr. Cat. D-R-C-A-B. What is D? D is danger. Yeah, make sure that away from danger. We put the victim on a flat and firm surface. R. Yeah, R first. The check for response, isn't it? So for adult, how we check for response? We will tap on the shoulder. Hello, hello. Are you okay? So for baby, we will gently tap on the sole, tapak kaki. So then we check for response. If no response, we check for pulse and respiration simultaneously, serentak. And for 5 seconds and not more than 10 seconds. No pulse, no respiration. Then we will call for rescue. Yeah, we will call for rescue. Call 999 for ambulance and bring AED. And after that, we will start CAB. CAB, C is compression. And what is the ventilation, compression to ventilation ratio for 1 man CPR and 2 man CPR? 30 compression, to 2 ventilation. But for infant, if there are 2 rescuer, we will do 15 compression to 2 ventilation. So we give compression, then A is for airway and B is breathing. How to open airway? Head tilt, chin lift. Yeah, so head tilt, chin lift, and then we give the ventilation. Okay. So you remember our high quality CPR? So high quality CPR, let's revise. Number 1. Okay, before push hard, push fast, you must recognize. You must start CPR within 10 seconds of recognition of cardiac arrest. Then our high quality CPR, push hard, push fast. The rate is 100 to 120 per minute. That berapa dalam for adult? Minute at least 2 inches. Yeah, 2 inches. Yeah, 2 inches. How many cm? 5 cm. Yeah. Okay, 5 cm. So that lagi push hard, push fast. The rate, other that. Then okay, avoid excessive ventilation. Then how you know that the ventilation is sufficient? Chest rise. So another quality is complete chest recoil. So when you compress, you make sure that the chest come out, then only another push. Yeah, so complete chest recoil, and then push hard, push fast, complete chest recoil, and then avoid excessive ventilation. Lagi, avoid interruption during our CPR and limit to not more than 5 seconds. Okay, so that is high quality CPR. So again, when we even for this is for BLS for victim who have cardiac arrest. But what if a victim who experience choking, tercekik? So adakah masih guna Dr. Cap?
Yes.
Yes, when the victim is unconscious. So when come to choking, there's always have 2 conditions. One is when the victim ataupun mangsa masih sedarkan diri, when they are still conscious. So when they are conscious, for adult who are conscious tetapi tercekik, how you will help them? Kita akan carry out what maneuver is that? Helmet maneuver ataupun abdominal thrust. Yeah. So we will try to above. You just put a fist and then above the belly button. Yeah. Upper our pusat. Yeah. So you just push inward and upward. Yeah. So you try by doing so. Hopefully we can give some pressure. Yeah. Increase the pressure so that push the foreign body out. So we will repeat until the foreign body is out ataupun the victim telah unconscious first. Yeah. Kalau unconscious, we go back to Dr. Cap. Yeah. Go back to this Dr. Cap, but for the R hanya satu kita buat saja. Just call for rescue straight. Why? Because you know this victim memang tercekik and you are with the victim. So you know, so tak, no need to go and check pulse because memang unconscious already. So you just call straight. You call 999 for ambulance and bring AED, and you start your CAB, start your compression. But every time before, when you open your airway, open the victim's airway, one exceptional step you need to do. Tongue, jaw lift to check is there any foreign body inside the mouth. Kalau ada, we will use the, we will maintain the tongue jaw lift and then guna index finger to sweep towards us. No blind sweep. Maksudnya kalau tak nampak apa-apa, don't sweep. Hanya when you see something, ada benda asing, ada foreign body, then you sweep towards us. But for infant, guna this jari, ya, the little finger. So use the little finger to, ada yang lupa off phone ya, tak apa. Okay, so now we continue ya. So kalau infant, we will sweep dengan little finger because baby's mouth is small. Then if already check ready, baru blow. If there's no chest rise, reposition, then give another blow. Kalau other chest rise ready, then you reconfirm. That is for choking. And of course, we also learn a little bit on the first aid, how to stop perdarahan, yeah, give direct pressure, and then also like contoh, ada yang suspect fracture ataupun ada kecederaan terselio kaki ataupun tangan, and we do bandaging and splinting yang telah kita pun tunjuk dan belajar dalam sesi praktikal tadi. So any questions? Any questions? Adakah apa persoalan lagi you want to clarify before we end the session? Otherwise, we can see from the practical session, from the practical exam, practical test, semua dapat lakukan dengan baik. So I hope ini bukan, of course we end here, but I hope dia bukan end di sini, because this is a BLS certification. So harap-harap next time dengan kemahiran yang telah belajar, we do not know, we will never know, anytime, masa kita di luar ke, in any public places, or even in the workplace. So ada yang tiba-tiba ada mangsa yang collapse, that you are able to provide high quality CPR to increase the chance of survival for the victim. Tak semestinya kita akan dapat 100% selamat, but at least kita cuba sedaya upaya untuk increase the chance of survival for the victim. Boleh? So, and ada lagi soalan?
Inspect, when our BLS card certification 2 expired within 2 years, so how to renew?
Okay, that is very good question. Now, sudah ahead already ya. Boleh fikir after 2 years we will renew. So you can always come back to us. Yeah, we also offer a refresher course. So you can always contact us. Yeah, later I will share our contact, yeah, so you can keep in touch with us. Kalau ada in future ada apa-apa course, we will also maklumkan anda semua, and you can come and register with us. But after 2 years, you can come back with us. Of course, you say, you do not want to come with us. Of course, you can go to any CPR center or any institution yang offer CPR course. You can also renew there, no issue. Okay. Okay. Then later I will share a QR code, a link. Please complete your evaluation form. Your evaluation, your feedback is valuable to us. So I hope you will get your feedback. Thank you.